We're about to transition in just a moment to a test within a test. Healthier Washington is about innovating in our systems and our processes. And we're going to try to do something pretty different for an event like this, which is some breakout sessions that you all have signed up for, maybe without knowing it, where you're going to be tackling actually pretty hard, pretty difficult questions or problem statements, and you're only going to have 30 minutes to do it. So we know today that the solutions may not all arise out of this effort, but what we're intending to do is capture the richness of the discussion. You'll have facilitators. I'm going to invite those facilitators forward actually at this moment because they're going to introduce themselves. If you're here and available, come to the front right here if you would. You're going to have facilitators. You're going to have staff recording the discussion. And out of this whole day, the plenaries and the facilitated sessions, we're going to be producing a deliverable, a document that everyone who's participated in this today and other members of the public will be able to access to see the substance of the discussion. So you're going to be doing some problem solving here and what we're calling action generation related to provider engagement, rural health, elements necessary to scale and spread value-based payment, and alignment of Medicare, Medicaid, and private payers. So I'm going to ask everyone to look at their name tag. I can't look at mine. I don't have it on at the moment. You should have 3 dots on it, unless you're special, in which case you may not. But if you have 3 dots on it, the left dot is the color that you are headed to now. Those dots correspond with the colors that you have in your program, and you will have rooms assigned then to those colors. So our goal is to be in those rooms, ready to engage in this very time-limited problem-solving discussion by 10 o'clock, or even a little bit earlier to get settled. And now I'm going to have DJ introduce our facilitators.
Hi, I'm Karen American.
Hi everyone, Leah Rosengas with CoPel Solutions.
I'm Dana Steringer with DK Strategies. Ramona Ramadas with CoPel Solutions.
And Howard Springer, CoPel Solutions.
Great, I'm DJ Wilson. Should I walk through how this will work? So just to be clear, left, depending on how you're looking at your badge, is the one on the edge. If you're looking down at it, it might be a different perspective. Turns out many of you are already in your breakout room, depending on your color. By that I mean we're going to transform this room very quickly into 3 breakout sessions. And so there are air walls here, and the staff of the hotel will bring out the air wall so that we will have 3 breakout rooms right here and the 4th down the way. So if you open up your program here, you'll see 4 colors. The green color is the Paradise Room, which is down the hall, which will be our lovely Karen American's room, and she'll be our primary facilitator there. The yellow room, or Dallas, is going to be over here on this end. I won't tell you whether it's left or right, let's just so go that way. Blue is right here in the middle, and then the red is on that end. So throughout the day, these will be the rooms into which we'll pour for our facilitated discussion. And our goal in these meetings is to do essentially 3 things in a very short amount of time. 1, have a general response to what you've heard here. 2, work through our problem statement as outlined in your program. And then 3, come up with some specific suggested solutions to solve at least some of the world's problems. So, Nathan?
Yes, and can I do one more thing? We have some other distinguished guests that I didn't get an opportunity to introduce earlier. John Reisman, would you stand up, please? Our Secretary of Health who serves on Healthcare Washington Government. Bob Crittenden, representing the Governor's Office, Special Assistant for Healthcare. And Representative Lori Jenkins, thanks for joining us. Please stand. Excellent. So I guess my only final encouragement is lean into this, be candid, bring problems forward, but bring the problem statements and resolutions forward as well, if you would. And thanks DJ and facilitators for helping us coordinate this. We'll get it done. 10 o'clock.